I have a disease you've probably never heard of, and I want to bring awareness to it because maybe you know someone who has it, maybe you've had these symptoms. It sounds like something I could have. I've talked about it before on other social media platforms. So many people have reached out to me. It's time to share my whole story. I was diagnosed with Nutcracker Syndrome June 2025, and ever since then, my life has been basically in a downward spiral. I spend the majority of my days now in fetal position in my bed because I can't really do anything else, and it really sucks. Let's talk about what is Nutcracker Syndrome. It kind of sounds nice. The ballet, pirouette. Let me tell you, nutcrackers are my number one op. During Christmas time, I spot a nutcracker and I'm like, you're my op. Let's talk about what Nutcracker Syndrome is. Nutcracker Syndrome is a rare vascular condition that occurs when the left renal vein is compressed between abdominal aorta and the supramesenteric artery. It causes restricted blood flow, forcing blood to back up and resulting in pelvic congestion. Your renal vein getting squished. When I lay in certain positions, it feels like my left side of my abdomen, which is the flank area, feels like it's going to explode. I'm not even joking. It's so much pressure and pain. It's extremely painful. My only symptom has been left-sided flank pain, and that started about a year before I got my diagnosis, and it started very slowly. At first, it would just be laying on my right side. I felt a little bit of pressure, just a very little bit. I thought that was weird. I thought it was maybe just like a muscle strain or something. And slowly it started to get worse where I couldn't lay on my left side. If I was laying on my right side and my fiance would hug me across my left side, I'd literally feel like so much pressure. We started calling that like karate chop, like you're karate chopping me, because that's how it felt. Turns out that was literally a condition. And as time went on, it started to get worse where I couldn't lay on my left side. Similar pressure started to happen. May and June of 2025 is when it got to its worst. It felt like it was literally going to explode when I'd lay on either side. It was hurting while I was sitting down, walking all the time. And I could not deal with the pain anymore. The only time the pain was okay if it was lying on my back or lying on my stomach. Other symptoms that you could have are hematuria, which is blood in the urine. It could be visible or it could be microscopic. It could only be picked up in your urine lab testing or those like swab things. Another symptom that could be connected to it is pelvic congestion syndrome. They saw in one of my CAT scans, which led me to be seen by Vascular. So I was kind of lucky. Here are some symptoms. Hematuria, like I said, blood in the urine. Flank pain, which I have. Pelvic pain or lower abdominal discomfort. This one is for men. The restrictive blood flow can cause painful swollen veins in the scrotum. For women, it is the pelvic congestion syndrome, which can cause chronic pelvic pain, painful periods, and painful intercourse. Proteinuria, which is leaking of protein into the urine. How does Nutcracker syndrome happen? There are 3 different ways it can happen. Number 1, you lose a significant amount of weight. So the majority of patients that are seen are severely underweight, severely malnourished. That's why when I went to my first appointment to the urologist, he was like, oh, you're not the typical patient. And I was like, yeah, I know, because I'm actually, at the time, I was like overweight. Usually the first course of action is to gain weight. That can be caused by rapid amount of weight loss. Number 2, could have been there since you were born. And number 3, which I think happened to me, is it just kind of happens. Some things are just idiopathic. Type of doctors you want to see. If you can find in your area people who specialize in Nutcracker syndrome, I know it's really hard to find specialists because it's a very specialized disease. A lot of my doctors that I've seen, cardiologists, internal medicine, ER doctors, they don't even know what it is. So hard to find specialists that know how to treat it. I was really fortunate to find doctors in my area that have treated it. Doctors who can treat it are vascular surgeons, transplant doctors, urologists, and nephrologists. So those are the type of specialists that you kind of want to look for. When you're calling about making appointments, I find it best to ask them right away if they treat Nutcracker syndrome, because you don't want to go through insurance, payment, the appointment. These are all super long processes to get there, and then they don't treat it. I find it best just to ask right off the bat to save everyone's time. What kind of testing can they do to find Nutcracker syndrome? You need to have imaging done. You can have a renal Doppler, which is an ultrasound. Another one is a CT angiogram. You're just having a CAT scan. They put an IV and they inject iodine to look through your vessels to look for that compression in your renal vein. Another one is an MR venogram, which is an MRI, which is significantly longer. I think it's like 30 minutes, something like that. That's with contrast as well, but they use gadolinium. Both of those can detect Nutcracker syndrome. Another recommendation I have to always get your discs. Not all systems are like intertwined, and so to save you a lot of time when you're getting your tests done, just be like, can I have a disc? I also find it best to start keeping a record of all your symptoms, of when it started, tests you've had, the results of the test. So if you go to different places, don't have connective electronic medical systems, it's just much more organized and easier for you and the provider. Once I see in the imaging that you do have Nutcracker syndrome, what they do next is more invasive. It's called intravascular ultrasound, also called a venogram. This is actually a procedure. You don't eat anything at midnight because they give you like a light kind of sedation. You're not completely asleep. It's basically like fentanyl, Versed. They go in through your neck or they go in through your groin, and they insert a catheter and they go through to look at your renal vein and inject contrast to see the amount of blockage. So when I did that, I ended up getting anaphylaxis. Fun. Allergic to iodine, contrast iodine, and my allergy is anaphylactic. When I first had my CT, which showed the renal vein compression, I had full-blown anaphylaxis, and that was my first time going into anaphylaxis. Thank goodness I was in the emergency room because that was terrifying. My venogram wasn't able to complete the whole thing, but they were able to see that the renal vein was significantly compressed. So that's what makes my story kind of harder, but if you're not allergic to contrast, you are good to go. Now let's talk about the ways to treat Nutcracker syndrome. You could just manage your symptoms, live with it. I know some people do that if it's not that severe. Number two, if your reason for Nutcracker syndrome is significant weight loss, to try to gain weight, these are the 3 surgical interventions you could do. Number 1 is the left renal vein transposition. It's when they take your renal vein and move it to a different position. And that's what I did. That could be done either laparoscopically or an open surgery. For me, it was done laparoscopically, and it seemed the most minimally invasive out of all 3 options, so that's why I chose it, and I still think that it was the right decision for the time. Number 2 is an auto transplant. They've removed the affected kidney and re-implant it in the lower abdomen or pelvis where the vein can drain freely without compression. This is major surgery, so I was kind of put off to that, and that's why it wasn't my first choice. And then number 3 is a nephrectomy, where they remove your kidney completely. This could be done where they just discard it, which I'm not saying any of these are the wrong choices, but for me, I wouldn't want to just take out my kidney and just throw it away. There's so many people out there waiting for a kidney. If there is a possibility that you can donate it, please look into that. So where am I now in my Nutcracker syndrome journey? Why am I in fetal position every day? Like I said, I had the left renal vein transposition. I had it in October 2025. Yes, my diagnosis to treatment was pretty fast because I advocate for myself very, very, very intensely. Like, I will go to a new doctor, I will push, because I knew something was wrong. And if you feel like something is wrong, you know yourself best. And I don't know if it's because I'm in the medical field and I have that, knowledge or whatever, but I knew something was wrong and I wasn't going to take no for an answer. And they did say no at first. My doctor was like, I'm not sure if you have Nutcracker syndrome because you only have one of the symptoms, which is flank pain. And I was like, I have never experienced this in my life. No way is this normal. So I got the surgery in October and it was done laparoscopically. The surgery was about maybe 4 hours. I ended up having an allergic reaction to the temperature probe, the anesthesia put on my forehead. I'll insert a picture here because it's a great look. After that, I stayed in the hospital for about, I think 1 day. I had about 4 incisions around like my pelvic area. And it was pretty painful after surgery, I'm not gonna lie. It was uncomfortable. I had a catheter in. That was actually really uncomfortable. I was like, can we get this out? Let me pee on my own, I promise. The first time I walked was absolutely painful. Like, that was so painful. When I went home, I have to say the worst pain was the gas pain, because when you get laparoscopic surgery, they put gas to blow up your abdomen so they can see it better with the camera, and that is the worst pain. My advice is walk around right away. Take your stool softeners. I don't like taking pills, so I didn't take any. I also didn't take my pain medicine because I don't like taking pills. That was a mistake. Take the pain medicine, okay? Do not suffer in silence. It was so uncomfortable, so painful. I ended up in the ER. Everything was fine, but I was in so much pain from, I basically think it was from the gas pain. They also put you in Trendelenburg, which is like this during the surgery. So I think like my muscles or something. I was in so much pain after surgery, not just like from the area. 5 to 6 months after the surgery, I felt amazing. I got to go back to work. I was back to normal, doing things, starting to work out again. It wasn't until about, I guess it was a month ago now, or a month and a half ago, I started to experience the left-sided flank pain again, and I was absolutely crushed. I was so upset, but all the imaging said that there was no compression. So I was like, oh, this is weird. Everything looks fine. I was in the ER 3 times. That's how bad it was. And it's still pretty bad to this day. So when I saw my doctors, they said that, you know, this can happen. My vascular surgeon suggests I, you know, go to pain management. I got the ganglion block, which was in my butt crack region. That did not help. The other block that I'm going to be trying is the celiac plexus block. Pain management doctor said that it probably won't work, but he's willing to do it. You know what? I'll try anything at this point. They also suggest I look into auto transplant or donor nephrectomy, which I've been doing. It is a big decision to make because those two are really big surgeries, especially donating your kidney, because that is an organ that you may possibly need in the future. But when you're in so much pain every single day, it looks like a great option. I've read a lot of journal articles that had similar issues like mine, where they had the left renal vein transposition. All their imaging say the renal vein is open, but they're still having pain. Once they had surgery, it got better. All of the doctors say that I could have surgery, but then my pain won't resolve. So that is the big risk and big decision I have to make, and something I have to keep in my head. It is really hard to think that I could go through donating my kidney and wake up and still have pain, because I know I don't want to do auto transplant. So I know the route I'm gonna go is donating my kidney. If I wake up and I still have pain, I would be devastated. The thing is, at least I know I donated my kidney to someone and I helped save someone's life. At least I have that. I've tried acupuncture, other kinds of like OMT. It's something like osteopathic medicine where they like put extreme pressure. It was like one of the most painful things I've ever tried. I've tried that. I've tried the injections. I'm gonna try another injections. I've tried things that are not invasive. And if none of those work, I kind of left with nothing. And I'm only 32 years old. I don't feel like I can live my life in pain like this for the rest of my life. So that's why I'm like, I need to donate my kidney. I need to try. So that is my journey now, where I am going to try to donate my kidney. And I'd like to take you guys all on this journey because it's not an easy one. And I know there's a lot of people out there like me, and I want you to know that you're not alone. I've received all your messages and support, and I'm so glad that you know that you're not alone in this, because there's so many people like us with Nutcracker Syndrome suffering. And if you made it this far, thank you so much for listening, and welcome to my journey. Thank you.